Hi, I'm Joanne Simmons, Senior Risk Consultant at ProAssurance. The 21st Century CURES Act, enacted in 2016, provided new regulations on a variety of healthcare concerns, including funding, research, access to new and experimental drugs, telehealth, and interoperability of health information technology. Specifically, within the context of the CURES Act's discussion of interoperability of health information technology, the Act introduces a new phrase to the healthcare community: information blocking. The CURES Act defines information blocking as a practice that is likely to interfere with access, exchange, or use of electronic health information. The Act also defines the actors that the rule applies to, such as healthcare providers and other defined entities. Exceptions are those required by law or specified by the HHS Secretary as reasonable and necessary or as likely to interfere with access, exchange, or use of electronic health information. The CURES Act prohibits such information blocking. Healthcare providers found to be engaging in the practice are subject to monetary penalties or reimbursement disincentives from federal healthcare programs like Medicare and Medicaid. The information blocking provisions of the CURES Act are also referred to as open notes. Unless one of the 8 regulatory exceptions applies, healthcare providers who do not make clinical notes open and available for their patients are engaging in the practice of information blocking. The United States core data for interoperability include 8 types of clinical notes that must be made open: consultation notes, discharge summary notes, history and physical, procedure notes, progress notes, imaging narratives, lab report narratives, and path report narratives. Regulatory exceptions to information blocking fall into 2 categories: those that involve not fulfilling requests for access and those that involve procedures used for fulfilling requests. Exceptions in the first category include preventing harm to the patient or another, protection of health information privacy, protection of health information security, infeasibility, and health IT performance. The exceptions in the procedures category include limitation in content and manner, reasonable fees, and licensing. The compliance date for healthcare providers to meet this open notes requirement for the CURES Act for the electronic health systems was April 5, 2021, but the work didn't end there. By October 6, 2022, healthcare providers will need to make the same information available on a patient's third-party application or be in violation of the information blocking requirements.